Good afternoon, my name is Lloyd Williams. I'm a consultant orthopaedic surgeon specialising in foot and ankle surgery, and I'm here to talk to you today about bunion surgery at my place of work, OneWelbeck in central London. Bunion surgery is otherwise known as surgery for Hallux Valgus, which is the condition where the big toe drifts towards and under the second toe, and this can cause pain, deformity, cosmetic problems and difficulty with walking, and certainly with choice of shoes. It's much more common in ladies, is usually on both sides, and often is familial. In other words, a genetic predisposition to this problem. So with bunion surgery, it's perfectly reasonable to operate on both feet at the same time, provided the patient is fit enough, and that is almost always the case. Traditionally, bunion surgery has involved quite big incisions, but now almost all cases would be performed by myself at least with a minimally invasive technique. The common osteotomy now in Britain is known as a scarf osteotomy, whereby the whole length of the first metatarsal is cut and shifted towards the second toe and then fixed with 2 screws. This is a very reliable technique, but does involve a much bigger wound than minimally invasive surgery, and consequently more swelling. Also, the joint needs to be opened, and there's also more risk of stiffness and wound problems. With minimally invasive surgery now, the surgery can be performed through 5 or 6 tiny incisions as opposed to one very long one. The operation doesn't take any longer, patients can often be discharged quicker, and there's a lot less pain, swelling and stiffness. After 2 weeks, a wound check is performed, sutures are trimmed or removed, and physiotherapy can be commenced near the patient's home. At 5 to 6 weeks, the patient is then seen for an X-ray, and the patient can then get into trainers or Birkenstock type sandals and is also allowed to drive. If the left foot is operated on only and the patient has an automatic car, they can probably drive after 10 to 12 days from surgery anyway. With regards to further rehabilitation, more physio is usually needed. Not all of the swelling will go down for 6 months from surgery, whether this is by minimally invasive or open technique, but of course there's much less swelling minimally invasively in the first instance. It's rare to get a bunion recur, and this occurs probably for 2 reasons, namely, firstly, undercorrection by the surgeon, or if the patient wears very tight fashionable shoes too much and too often. There's certainly no problem with wearing tight shoes on evenings out and for certain occasions at work, but to wear tight shoe all the time will cause some recurrence. When to seek help regarding bunions? Certainly if bunions are painful, there's no point in delaying, because really bunions never get better on their own, they only slowly get worse.